Hello there. Opening affirmative constructive speech for universal health care. Kayla affirmative versus Justin negative. Good evening, judges and audience. My name is Kayla, and I stand firmly on the affirmative side, advocating for the United States to adopt a universal healthcare system. The United States is the only wealthy, industrialized nation that has not achieved universal health coverage. Our current healthcare model is not only inefficient, but also unaffordable, unsustainable, and inaccessible to millions. This is a moral and economic failure. According to Dr. Ed Weisbart from 2012, our fragmented system results in per capita costs that are twice as high as those of other modern nations. Yet our outcomes remain mediocre. 30 million people still lack insurance under the Affordable Care Act, and many more are uninsured. This gap in coverage drives personal bankruptcies, delays in care, and needless suffering. It is unacceptable that the richest country in the world, a medical emergency can lead to financial ruin. A single-payer model would reduce these costs by eliminating administrative waste, consolidating billing systems, and negotiating fair prices for services and medications. Moreover, value-based care, where outcomes matter more than profit, can further lower costs and improve health outcomes. Other countries that have implemented universal health care enjoy better population health metrics, longer life expectancies, and lower infant mortality rates. But this isn't just about economics, it's about equity and justice. According to Perry in 2021 from Brookings, highlights many essential frontline workers of color, marginalized communities were disproportionately uninsured during the COVID-19 pandemic. These workers who are vital to our economy faced higher medical debt and worse health outcomes simply because they lack adequate coverage. The pandemic revealed deep gaps in our healthcare system that left the most vulnerable at great risk. Universal healthcare addresses these systemic racial disparities by ensuring that every person, regardless of race, income, or employment status, has access to the care they need. It promotes a more just and inclusive system where no one is left behind due to financial or structural barriers. Beyond the financial and logistical benefits, universal healthcare strengthens national unity by enforcing our shared responsibility to care for one another, especially the most vulnerable. When financial barriers to care are removed, people are more likely to seek help early, manage chronic conditions effectively, and avoid preventable emergency situations. In contrast, our system relies heavily on reactive approach, waiting until health problems become critical before providing care, which is both costly and inefficient. Shifting to a proactive model focused on prevention and early intervention would improve long-term health outcomes and significantly reduce unnecessary spending. In conclusion, universal health care is not just an ideal, it's a necessity. It improves access, reduces costs, addresses racial biases, enhances population health, and aligns with moral values of a just society. The time is to act now. The American people deserve a healthcare system that puts their well-being first, one rooted in compassion, fairness, and common good. Thank you.